Honestly, I think one word really jumps out at me when I think of how to compare MCG with other institutions, and that's community. It's seen in the housing system, the academic house system here, to make sure that you get to know your fellow student in a more closed quarters, but also the House Olympics that we have once a year, where you face off with different houses and different groups, TBL, PBL, PD, all these abbreviations that I had no idea what they meant when I first came here. But they're basically just different groups and different learning environments where you get to know different people that you may not have gotten the chance to get to know without those groups. So I'd say community is something that MCG really values here.
I feel the culture here is that even though there's over 200 of us, it still feels very intimate. Like the students are very together. You never feel alone, which I believe the admissions committee did a really good job of selecting a diverse student population, but it still feels like you're not out of the crowd. You still feel like you can make friends and have somebody that's similar to you, but really explore other people and their differences.
So something about our campus in Athens is that we have an open door policy, and the student to teacher ratio is quite low, which means that we can just show up to a professor's door and be able to get the help that we need without any problems.
So probably the most impactful part for me was when I first came in, I was surrounded by so many mentors in the first few months of school, whether it was the second years that were mentoring us as first years on how to get through the year, or third and fourth years who were telling us what to expect down the line. Even some residents I got mentored by through interest groups, and faculty and staff who took an interest in what my interests were and helped me to foster those and get involved in things that I was interested in.
So here in Athens, our faculty do a great job of trying to throw us in to the clinical environment as soon as possible with different research sites around the community. And so within the second or third week, we were seeing patients, and not just like simulated patients, but patients that really needed care. And I remember we had a patient last fall who came in with a lesion on his scalp, and the doctor that we were with diagnosed him with a cancer, and we sent him off and had that biopsied and treated. And that was a really impactful experience for us, thinking as first-year medical students, we could impact somebody's, medical experience in such a way. It was really cool.
So we're privileged at MCG to have lots of student-run clinics, and these are great for not only students to learn and practice their physical diagnosis skills outside of a simulation setting, but it's also really good for the community because we serve patients who are greater than or equal to 200% below the federal poverty line and who don't have insurance. And so a lot of these patients wouldn't be able to be seen anywhere else. And so it's really nice for them to have a place that they can come to, still be seen by a licensed physician. And for our clinic specifically, they can also interact with interpreters because communication is a really big barrier for the community that we cater to.
MCG really prioritizes community engagement. We say a lot that Georgia is our campus, and that really is true. We have campuses all over the state, and the MCG network of physicians is really widespread. And I think it is important how MCG reminds us who it is that we serve. We serve our patients, but we also serve our community. And I think keeping that in the forefront of our minds as we go through this education has been really outstanding. And I'm proud to be at a school that really focuses on taking care of rural parts of Georgia and making sure that no one is left behind.